All right. Well, welcome everyone to the microbiome and metabolism. We're going to be talking with Dr. Jill Carnahan and Adam Perlman today, kind of a clinician to clinician chat about all these exciting strains and how they can support whole body health and specifically the metabolism. So without further ado, let's jump in. Just some housekeeping. We will be recording this presentation, so you will receive this recording within 24 hours of us stopping this beautiful show. Please put all questions in the Q&A rather than the chat. Hopefully the Q&A is working. Let me know if you're having any trouble, but we'll make sure we get it all sorted out. And finally, the last thing is that we're going to start to introduce the presenters. So starting with Adam Perlman. Adam is our Chief Medical Officer at Pendulum Therapeutics. He formerly served as the Director of Integrative Health and Wellbeing at Mayo Clinic in Florida, Medical Director for Employee Wellness, and prior to that, he was Associate Vice President for Health and Wellness for the Duke University Health System. He was overseeing Duke Integrative Medicine and the Duke Diet Center. Dr. Perlman received his BA from Tufts University and his MD from Boston University School of Medicine, completing residencies in both internal medicine and preventative medicine, as well as a general internal medicine research fellowship at Boston Medical Center. He earned an MPH from the Boston University School of Public Health. We're grateful to have you here, Adam. Thanks for joining us today.
Great to be here.
And next we have Dr. Jill Carnahan. She is your functional medicine expert. She is duly board certified and founder, medical director of Flatiron Functional Medicine, a functional consulting practice in Louisville, Colorado. I had to look it up, make sure it was in Louisville. But as a survivor of breast cancer, Crohn's disease, and toxic mold illness, she brings a unique perspective to treating patients and specializes in searching for the underlying cause of illness with personalized medicine protocols. As a popular inspirational speaker and prolific writer, she shares her knowledge of hope, health, and healing live on stage and through newsletters, articles, books, and social media. Her science-backed medical knowledge is delivered with authenticity, love, and humor. She is known for inspiring her audience to thrive even in the midst of difficulties, which we've seen her gracefully do with breaking her arm this past weekend and just smiling through it all. So thank you so much for being here, Dr. Jill.
You're welcome. It is my delight and pleasure.
Awesome. Well, let's just jump in. We're going to have some nice question and answers, some nice science and background. And so starting it off, Adam, how often were you seeing metabolic syndrome in your practice?
Yeah, so it's an interesting question because, the short answer is very often. And I think for most of us that practice medicine, it's an issue for many of the patients that we may see, certainly adults. I think the problem is, although 1 in 3 Americans has metabolic syndrome, I think very often, and this is what I experienced in my practice, they weren't necessarily aware of it. Because if you think about the criteria, if your blood pressure is elevated, if it's extremely elevated, you might feel that. But in general, you typically don't feel, relatively moderate elevations in blood pressure. Certainly, you're not going to feel a low HDL or elevated triglycerides or elevated glucose or blood sugar. You might notice that the circumference of your belly is getting a little bigger in terms of the visceral adiposity. By and large, though, it's something that people may be suffering from and just aren't aware of it. And obviously, that's the criteria for metabolic syndrome. And I think the problem is that, we're not aware of something, or our patients aren't aware, my patients weren't aware of something that has really potentially catastrophic downstream ramifications. Dramatically increases your risk of death from coronary heart disease, cardiovascular disease, overall mortality, and then things that maybe people don't think about as much, like it increases your risk for depression. So really important that everyone sort of sees their primary care physician or healthcare provider and make sure that they're getting these kind of things looked at, blood work, on a routine basis, what have you. Of course, then how do we treat metabolic syndrome? I think in that case, for 25, almost 26 years now of doing integrative and functional medicine in my practice, I often focused on the kind of top boxes there. But very often, people need to resort to medications, pharmaceuticals, things to help manage their cholesterol or triglycerides, their blood pressure, obviously their blood glucose. Certainly in a practice like Dr. Jill and mine, we obviously rely heavily upon dietary recommendations, lifestyle modification overall. I think what's exciting, particularly for functional medicine practitioners, as we are, that we like to try to get at root cause and try to work at the level of the biological systems, what's going on at that level that may be driving this, metabolic dysfunction. And what we've come to now understand is that much of that is driven by, yes, what we eat perhaps, but how what we eat influences those bugs inside of our gut, referred to as the microbiome. And thinking about this condition and other health-related issues from the perspective of the microbiome has become a really powerful way to address a person's medical issues and concerns, particularly metabolic health.
Awesome. Thank you for that. Related to on a similar vein, Dr. Jill, how are you addressing metabolic syndrome as a functional medicine practitioner specifically?
Yeah, so just tagging on to Dr. Perlman, first of all, we obviously look at diet and lifestyle. So I always think of just very simple interventions like movement after your largest meal of the day. That'll often lower glycemic index. If you just simply take a walk after dinner, how simple is that? And it really has a profound effect. Eating your vegetables and fibrous foods first in order, and then you tend to delay the glucose spike versus if you first eat your dessert or first eat your, sweet thing before dinner. So there's some simple things there. And then of course, movement, activity always affects us. And then like you mentioned, Dr. Perlman, some of those great supplements we've been using for a long time, like berberine, plant sterols, any of the fibrous types of supplements or food additives. There's so many ways that we can address this. And then when it gets severe, I like you, use medications. To me, the most exciting forefront is this gut access, because we know that at the core, it's literally these bacterial coatings that are crossing over into the bloodstream that are driving obesity, diabetes. They're called LPS, for short, lipopolysaccharides, and they are driving all of the metabolic diseases that we see. When I first years ago really understood the LPS endotoxemic effect, I was like, wow, this is the cause of diabetes, obesity, heart disease. And it also bleeds into mood disorders, depression, anxiety, insomnia. And there's even evidence for relation to autoimmunity and low testosterone in both men and women. So things that you might not expect to be connected are often, as you mentioned, Dr. Perlman, connected to the gut. So like I said, now we're starting to use interventions at that level.
Yeah. Very exciting. I'll just add one more because I just love this example. I had started the integrative functional medicine program at Mayo Clinic in Jacksonville, Florida, and I got a lot of referrals from our headache doctors. And I would be working with these headache patients on adjusting their diet, addressing the microbiome, leaky gut. And in one of the referrals, one of the headache physicians actually in the referral put referring to Dr. Perlman to address neuroinflammation. And it was like this big aha, like even non-functional, non-integrative physicians are finally starting to get it, understanding that these lipopolysaccharides can cross the blood-brain barrier and may be the issue. Whereas historically, we never thought of a headache patient, oh, let's focus on healing your gut. But it's an amazing time and this whole gut access with so many different aspects of our health.
Yeah, I remember back in the day, just a funny story, I'd get a college student that the mom would send in to see me for depression, anxiety, mood disorders, or insomnia or some sort of thing in the brain. And I would talk to them, get their history. And then right before they left, I said, okay, let's do some testing. And one of the things I'm going to do is a stool test. And you should have seen the look on their face, this 21-year-old male. And they're like, what? You want my poo? And the deal is, like 20 years ago, we knew that this gut, the microbiome, the strains that are keystone like Akkermansia have to do with every system in the body.
I've seen that look on a 51-year-old male
exactly.
too, but
yes. Yeah.
Interesting. Yeah, you guys run into some fun conversations in your line of work for sure.
Yeah.
So kind of along exactly the lines of what you're both talking about, I want to pitch this question to both of you. But really, how can providers and how have you as providers leveraged the microbiome to impact metabolic health in your practices?
Well, I guess I could start with, I've been teaching this for years. And one thing I really wanted to say here, because it's been on my tongue with practitioners as I've taught the gut and the microbiome and testing for years, is number one, diversity is king. Like above every principle in the gut, having a diverse gut microbiome is the key to longevity, resilience, and really overcoming almost any complex chronic disease. Now, what does that mean? The misnomer is like, oh, well, let's take a 10-strain probiotic and get diversity. No, that's not how it works. It's almost like you could take a 10-strain probiotic and create monoculture because you're just throwing in those 10 strains. So what we learned from the research is that diversity comes from diet, number one, and there are certain strains like Akkermansia and Faecobacterium prausnitzkii and some of these others. Akkermansia has always been at the top of that list that really indicate diversity. So just having enough Akkermansia alone on testing would indicate that you have a diverse gut microbiome. So there's very few strains that could be so correlated with diversity as a whole. And what I was going to say earlier is, as I've been teaching these physicians over the past 20 years, one of the things I say to every single audience is Akkermansia is key. Akkermansia is an indicator. And if someone ever creates a probiotic with Akkermansia, they're going to do really well. So I've been predicting this like need for this. So when you guys as a company came out with Akkermansia, I was your biggest fan because I've been saying for years how much this strain matters.
Yeah. Awesome. I love that story, Dr. Jill.
I think maybe the next slide will help me to summarize a little bit, because I think really what we're talking about is this idea of this gut metabolism connection, or it's often referred to as the gut metabolism axis, and this idea of how our gut microbiota influences metabolism. I'm going to digress for half a second, because often people use the word microbiota, microbiome interchangeably. Technically, the biota refers to sort of the bacteria, the actual bugs, let's say, in the gut, and the microbiome is the genetic material. But I think nowadays it's fine to use it interchangeably. But so this whole connection is really, really interesting. And we know that it's really, the connection can go either way, meaning when you have good bugs, good diversity, to Dr. Jill's point, plenty of things like Akkermansia, that supports better metabolic health in general. The mechanisms here are interesting. We'll talk a little bit about that as it relates to Akkermansia a little later in this presentation. But, you know, at a minimum, there are associations. And then I think where the research is going is truly to define what is sort of cause and effect, you know, beyond associations. But we know, for example, that in individuals who have lower Akkermansia, in general, that tends to be associated with higher body weights, higher BMIs, higher cholesterol levels, higher levels of fasting glucose or insulin resistance. We also know that you can have higher levels of either pathogenic or potentially pathogenic bacteria that can induce really inflammation in the body, almost going back to what Dr. Jill and I were talking about earlier. I mean, when someone comes in and is complaining of joint pain, you often don't think about the gut, but we do, because that may be the source of inflammation that's manifesting, you know, downstream in other parts of their bodies.
Yeah, absolutely. And kind of going into the mechanism a little more, Adam, I'd love to have you talk us through this slide a little bit to kind of correlate to what you were just saying.
Sure. I mean, this is a slide that highlights several different strains of bacteria, ones that we've actually put into pendulum glucose control and metabolic daily, but that actually support GLP-1. And it's interesting to think about the birth of this company over 10 years ago, you know, by PhD microbiologists. You know, I don't know that they could have predicted back then what GLP-1 would look like nowadays, and that everyone, you know, non-physician, what have you, is aware of what GLP-1 is because of some of these GLP-1 analogs that are being used, or these drugs that are being used by so many people. I think GLP-1 is a hormone in the body, of course, and the body has natural ways of stimulating GLP-1, and that happens largely through the interaction of bacteria in your gut, typically with foods that you eat, fiber, polyphenols, things like that. Akkermansia, and I think we have some slides later, I'll go into more detail, but Akkermansia mucinophilia, which is really mucin loving. I mean, one of the things it does is replenish what's called this mucin layer, that lines our gut, that helps act as a filter almost like fly paper, sort of catching things that shouldn't get through into the bloodstream. And then it also has this major role in stimulating GLP-1, and there's several mechanisms there. Again, we'll get into that in a little more detail. But then our bacteria work synergistically. I mean, they work together. And I think this is what Dr. Jill was also getting at. That's why this diversity can be so important. And so you want to have plenty of butyrate in general. Butyrate is a primary fuel for the cells that line the gut, called the enterocytes. And so there are bacteria that are butyrate producers. I've listed some of them here on the left side of the screen. And then you want to make sure there's enough fuel and food for those bugs in general. And that's where the Bifidobacterium infantis comes in, has a number of roles in the body. But one of the things it does is sort of break down these carbohydrates and fibers and then turns them into things like butyrate and lactate that then become a fuel for the other bacteria, the other bugs in the gut. And then all of that, in this case, leads to GLP-1, which has all these positive downstream benefits as it relates to metabolic health.
Yeah, awesome. Thanks for going through that.
Mm-hmm.
So kind of, I know we've alluded to akkermansia a lot, but kind of beyond metabolic health, beyond the GLP-1 production and the gut metabolic axis, what are the potential benefits of akkermansia beyond those health effects?
I'd love to comment. You heard in my bio that I've been through breast cancer and Crohn's disease and overcome both. And I'm considered cured of inflammatory bowel disease, which is really unheard of because in the medical system, we consider this a lifelong illness. But the truth is, as Dr. Perlman and I both know, when you really go to the root cause, even of autoimmune disease, we see reversible autoimmunity, which is kind of a misnomer in classical medicine. So it's exciting to come to you with a perspective of a patient who had severe Crohn's disease at 26 years old and say, I understood at that time that the diversity was core, and part of my healing involved getting rid of the bad guys, so treating bacterial overgrowth in the small bowel and fungal overgrowth in the small bowel, and then looking at colonic organisms, excess Klebsiella and some other things that were there, treating all of these things with food and medicine, including antibiotics and probiotics over an extended years of time. And now I am completely free of symptoms. And what I love about akkermansia is, especially with Crohn's and colitis, you need this mucosal barrier to prevent ulceration, which is the classic thing that we see in both inflammatory bowel diseases. And so this is one of those things that creates that mucosal barrier. And especially in conjunction, the way you've developed your probiotic, you actually have mucin producers, you have mucin lovers, you have the fermenters, and we need the fermentation in the colon is what creates. So we have fiber in the diet like artichoke and all the kinds of garlic and onion, all these things that are fermented. And then that fermentation allows fuel for the bacteria to produce short chain fatty acids like butyrate. And butyrate is absolutely essential for colonic health. And it's one of the first things that I think about in inflammatory bowel disease. So this to me is a way to actually induce production of butyric acid.
Yeah, I mean, just building upon what Dr. Jill said, I mean, I think as you follow the literature, it's hard to now even come up with a biological system that isn't influenced by the microbiome in some way. I think what's particularly interesting, again, like Dr. Jill, having done this for a number of years, we started very, very young, of course, that I used to use this expression, jump the shark. Like, when does something go from being more in the realm of integrative functional medicine to something that the sort of traditional conventional medical establishment begins to really accept? And I think, we're at this turning point in our healthcare system. I think increasingly, and this was a point I was trying to make with this headache doc, I mean, increasingly sort of non-integrative functional medicine practitioners are really recognizing, certainly in the case of the microbiome, the connection to the development of chronic diseases. And I think rheumatoid arthritis, for example, is a good example, one where we now know that there are bugs in the gut that, with the right genetic predispositions can trigger the development of rheumatoid arthritis. But it's also things like autism and asthma and colorectal cancer and kidney stones, all kinds of different health-related issues are influenced one way or the other by the health of our microbiome.
Yeah, absolutely. And thank you. Those personal stories, I think, bring it back home too. So having those examples is so great. So we've kind of built all up, but Adam, I'd love if you talk us through kind of the nitty gritty of Akkermansia and really how it does its job, how it gets in there and does all these amazing things.
Yeah, I'd be happy to do that. It's interesting for me to hear Dr. Jill talk about her understanding and her sort of discovery of Akkermansia quite a few years ago, and perhaps because of your personal experience. I've focused on the gut, been a proponent of gut health for many years, but I would say it's maybe more over the last 4 to 5 years that I appreciated some of these specific strains, and in particular, this idea of Akkermansia that often gets referred to as a keystone strain because it plays such a key role in the body. Now, it's a bacteria that really was discovered only in 2004, and the reason that we're seeing this explosion in these sort of next generation probiotics, as they often get referred to, is that the technology, to be able to grow things that are anaerobic, meaning obviously they don't grow in oxygen, can't be exposed to oxygen. That technology has gotten much better, much cheaper, things like genomic sequencing. And so I think that's led to an explosion of research on these particular types of probiotics. And it's been really exciting. You can see, just Akkermansia alone, how the publications have increased over the last 10, 11 years. And this is a slide that I'll just say up front, there's no quiz at the end, but let me just take you briefly through some of the mechanism of action here for Akkermansia, and maybe by the end of this, you'll realize why it is referred to as a keystone strain. So there's a few things going on here. First, on the left side of the screen is a number of sort of ways that Akkermansia influences health. So one of the things that it does is there is this protein on the outside of the Akkermansia called AMUC 1100. It's sort of hair-like, and it actually binds to toll-like receptors that then stimulate T regulatory cells to release pro or anti-inflammatory cytokines depending on the need of the body, right? And it's not like, oh, inflammatory cytokines are bad and anti-inflammatory are good. No, it's all about finding the right balance. Obviously, we need inflammation in the right circumstances. And so one of the things Akkermansia does is it helps to maintain that immune homeostasis. The other thing it does is what I was talking about earlier, what we were talking about earlier in terms of stimulating GLP-1. It again does that through several mechanisms that we're aware of. One is it does make actually all of the 3 of the major short-chain fatty acids, acetate, propionate, and butyrate. It makes primarily propionate that gets converted to butyrate. And then the butyrate actually binds to these G-coupled protein receptors, 41 and 44, that are on these L cells. And the L cells are what make GLP-1. So that's one mechanism. The second is that Akkermansia, live Akkermansia, actually releases a protein called P9, and that P9 protein also binds to these receptors on these L cells, on these ICAM2 receptors, and that also stimulates GLP-1. On the right side is really a very important as a function of Akkermansia as well that I mentioned earlier, and that it really eats up this old mucin and then really stimulates what are called goblet cells to make more mucin and actually stimulates sort of the development and replication of more goblet cells. So you make more cells and they make more mucin. So if we think about the gut lining for a moment, and I'm sure Dr. Jill and I know I both think a lot about what's referred to as leaky gut or increased intestinal permeability. Colleen, our CEO, likes to talk about the lining of the gut as a fence. And I'll maybe take her analogy and kind of expand upon it because, I think that fence has really sort of, let's call it nails that hold the cells together, right? And those might be these proteins that are in between the cells, these zonulins, occludin proteins. But then there's also this lining on the top of mucin, which, as I mentioned earlier, is kind of like a flypaper, sort of trapping things that shouldn't get through. And we want both the junctions, the tight junctions, those gaps between the cells to be appropriate. And we want that mucin layer to be healthy for the integrity of that gut lining to be what it is. And, if we think for a minute that the gut is really the biggest opening to the outside world, right? I mean, all day long, it needs to let in friend and keep out foe. So we actually took the small intestines and you could spread it out. The surface area, microscopically thin, would be, let's call it about the size of half the size of a badminton court. I was going to say maybe it's better nowadays to say maybe about the size of half a pickleball court. Um, and so it's a large area, right? So as I said, all day long, we need to let in friend, keep out foe. And so 70%, give or take, of the immune system functions at the level of the gut. And really, there is this sort of physical barrier of these cells with the mucin. And we want to keep that healthy so that we don't leak in extra amounts of, as Dr. Jill mentioned, these lipopolysaccharides, proteins from foods, other things that the immune cells, dendritic cells, other things can come over and say, I don't think this is supposed to be here, and trigger an upregulation of inflammation. So Akkermansia is one of the main bugs, or the main bug, that really keeps that mucin layer fresh and functioning the way that it should.
And I'd love to just tag on Dr. Perlman. One thing that I already see in the Q&A, we were talking about before we came on live, and I think it's important to mention now with this slide. So many of my patients are like, well, what if my Akkermansia didn't increase while I was taking it? Now, studies are out, and I think we'll know in the next year or two, does that really happen? But let's pause for a second and think about this. Everything you just mentioned is mechanisms of that probiotic acting either by what it's excreting or by its interaction with the immune system. There is nothing on this slide that shows the activation of more Akkermansia growing or even like planting a seed and increasing levels. So what if our outcome, again, I don't know the answer to this, but I have a deep suspicion that our outcome is more about this bug's interaction with our immune system versus pollinating a garden and growing Akkermansia. So those people who maybe say, well, did my Akkermansia increase or not? Maybe that doesn't matter. Maybe the mechanism of action is literally with the immune system. And we actually have studies with other probiotics that are dead that show the same thing, that show that interaction of a dead shell of a probiotic has the same effect on the immune system. And I just want to say that because I think as we get this, I see Sarah Hill as a question there, and I want to kind of head that off because I think maybe we're thinking the wrong thing. I think we may get the activity of the probiotic in the immune system, and it may be not as important to think about, are we increasing levels? And maybe it's actually diet that increases diversity, not taking a probiotic.
You make a great point. Maybe I could build upon your great point by saying, I mean, the way I like to think about it and talk to my patients about it is really this vast ecosystem called the microbiome, made up of, of trillions of bacteria, and it is really a communication superhighway, right? And so, I often think about the bugs as being ways that the body is communicating its needs, right? These bacteria want to keep the host healthy because, they want to keep themselves healthy, and we are hosting them. And so it's all about how they communicate the needs of the organism, in this case, us, in real time to help us to maintain our health and well-being.
Yeah, I love that you ad-libbed those in there. And on the vein of kind of what Akkermansia is doing, couple more things, Dr. Perlman, if you could walk us through that are really interesting from the research side of things.
Yeah, so again, I wanted to back up with some of the research, the statements I was making, because I think it's really important in general. With natural products, it's really important to look closely at the science. And in this case, this is actually some research that Pendulum did in the lab, so not in humans, but actually showing that our particular strain of Akkermansia actually does increase GLP-1 production. It does that in a dose-response way, but I want to be very clear that it's not in humans. We don't have that data yet, and actually does lead to increased levels, release and increased levels of the P9 protein. So this is some of that research.
Perfect.
And then this is a study that I'm particularly excited about. And again, I'd like to point out that it was or is a survey, so it needs to be followed up. And we are following up currently with a planned study to look at this in a more robust way. But in this particular survey of individuals using Akkermansia, what we found was that there was a significant reduction in food cravings. Very interesting.
So, but back to you, Dr. John. I know we have a couple questions in the Q&A that hopefully we can start off with. I touched on this already, but supporting Akkermansia levels in your patients with kind of the diet, nutrition, as well as the probiotic formats that you've been talking about.
Yeah, so like I said, I like to frame that because I think really it's so easy, even as practitioners, to think about the latest and greatest marketed probiotic out there. And years ago, it was like, oh, we have 10 strains and we have 20 strains. And there was no evidence for more billions and more strains that was any better. It was literally a marketing gimmick. And when I found that out, I was like, I was part of that. I thought, oh, these, 100 billion versus 20 billion is better. And it's not true. I mean, we just don't have I won't say it's not true. We just don't have the evidence to support that claim. So going back to food, though, food we know increases the production of short chain fatty acids, increases diversity. So I always love to really reframe this as, how do we really increase that in the lifestyle? And we need the fodder, which is the fibrous foods, polyphenols especially. I just literally wrote a blog article this week on polyphenols and the power. And we even, as a mold expert, we use this in mold detox. We need polyphenols. So we make sure that people are eating polyphenol-rich foods. The bright fruits and vegetables and colorful foods often contain lots of those. Other things are quercetin and curcumin, all filled with polyphenols. Movement is huge because we need healthy gastric motility, not only in the colon, but the migrating motor complex of the small bowel is like I talk about it as like between periods of an ice hockey game, they have that Zamboni that goes across the ice and makes the ice all beautiful and clear. I think of the migrating motor complex in our small bowel like a Zamboni. And I love that word. So I love to say Zamboni. But the truth is that Zamboni, so that's our migrating motor complex, and movement in our life and the types of foods that we eat, like ginger and artichoke, actually increase the migrating motor complex. And if that's not moving, we are going to get SIBO and SIFO because there's no clearing of that excess bacteria in the small bowel. Sleep is huge. I could do a whole lecture on sleep. And that's when our brain detoxes with the lymphatic system. That's when our gut, in fact, we know that between meals, about 4 hours after a meal, and then 2 hours before bed, we should give these breaks so that that Zamboni in our small bowel is able to move the bile and the clearing of the excess bacteria. And sleep is one of those times when it does that. Stress is huge because stress will lower SIGA. This is secretory IgA in the gut, and that's one of those risk factors for overgrowth of fungal organisms or pathogens or things. That's literally our gut's immune system. And we know that stress, things like norepinephrine and epinephrine, actually allow Clostridia to proliferate, things like lactobacillus to be lower, and it causes that SIGA to be low as well, which doesn't protect us at all from pathogens. And then, like I said, this live Akkermansia, I really, really think we're going to continue to see the research come out, and we already have a good baseline of how this interacts with the immune system. And whether or not it increases your baseline Akkermansia maybe doesn't even matter as long as it's interacting while you're taking it. And I think the factors that we should be looking at are your blood sugar, your A1C, your cholesterol, your weight, your cravings. Like, these things actually matter more than the numbers of bugs in your gut. So rather than focus on a repeat study of exactly what's there, I think we actually focus on the factors that matter, which are these metabolic indicators that 1 in 3 Americans are suffering from.
Yeah, that I'm learning so much just from your rundown of that, Dr. Jill. That was amazing. And kind of on the tails of that, we have a question of, what are you seeing signs of low Akkermansia that you might be using some of these strategies to support, is one of the questions that came in. Like, how do you know if a patient is coming in with low Akkermansia?
Yeah, so I do test. I do, and there's a myriad of good stool tests out there that are either using PCR or culture. I've moved to mostly PCR or combinations because we can directly test. And most of the good labs out there for functional medicine do test Akkermansia directly. It's one of the first things I look at in someone's stool profile, because if there's like 0 detectable, I know just by that one strain that they're likely to have a very low diversity, and I'm going to need to do food and all these kinds of things. They're also more likely to, as we've already mentioned, have metabolic syndrome, have obesity, or have overgrowth of dysbiotic organisms. They also could be more prone to Crohn's or colitis or even colon cancer. So I'm going to do all the things we just talked about, plus supplement probiotics and the appropriate strains so that we can get that diversity back. So yeah, Akkermansia, I'm a huge fan of it. I've literally been waiting for this for 20 years. So I'm like, wait, here it is. Let's do this. And I don't have a huge amount of clinical experience because I've only been using it for maybe 18 months. But in my experience so far, it's a game changer. It's one of my favorites. And then what I'll usually say is if you want to give this a try, let's give it 90 days minimum. Your studies so far have shown 90 days of some changes in A1C, and maybe Dr. Perlman, you could speak to specifics there. But I always say give it 90 days and then let's do your markers, let's do your labs, and let's see. And so far, I've had nothing but really good results.
That's the same approach I've taken in my clinical practice. I usually give it 90 days as well. I mean, I'll jump in with a couple of comments here. I think, as someone who also uses stool testing, finds low akkermansia, replenishes it. And now as someone who's, I love my role here at the company. I mean, half my role is to do things like this, help interpret the science for healthcare providers and the public. But the other half is overseeing our really extensive scientific agenda because the company's really committed to the science of the microbiome. And so we were just discussing this morning with our clinical research team a study that we're launching that is going to look at this idea of, how long does it take to see akkermansia show up in the stool and some, but it's complex because it may even vary depending on what, I don't want to get too graphic for your audience, but what part of the stool you sample. And so just saying here that the science here is complicated, but really interesting. And then of course, we always want to be supplementing the supplementation, or really the supplementation should be supplementing all the changes that people often need to make in their diet and their lifestyle that Dr. Jill, you were just emphasizing a moment ago. I'll add in one more piece because at the bottom it says, in addition to prebiotics, it says polyphenols, and I think that's the second or third time we've mentioned that. Obviously, you can get those through the diet, pomegranate, grapeseed, green tea, all kinds of things. You can supplement with polyphenols. We have a polyphenol product because we found it to be helpful in conjunction with our probiotics. A little fact, and I hope this isn't geeking out on the science for everyone in the audience, but I found this really neat. I just learned it recently. Polyphenols are obviously a fuel like fiber, kind of a food for the probiotics. But the other thing that they do is influence GLP-1. And let me explain how. So it's challenging to do research on GLP-1 because if you want to measure actual GLP-1 levels in human beings, GLP-1 lasts only a very short minute of time, maybe like less than 2 minutes, and then it gets converted to an inactive form of GLP-1. And so measuring that can be challenging. There's an enzyme called DPP4, which actually does that conversion from active GLP-1 to inactive GLP-1. And polyphenols actually have been shown to inhibit that enzyme. So they inhibit or delay the conversion of GLP-1 from an active form to an inactive form. So sort of another mechanism there, explaining why they're beneficial with when we're thinking about gut health and in particular metabolic health and trying to stimulate more GLP-1 in the body.
Wow, that's a fascinating little tidbit. Thanks for adding that in, Adam. And kind of on the veins talking about supplementing with polyphenols, a lot of questions come in about supplementing with butyrate itself and whether it's better to take akkermansia or supplement with a butyrate product alone. And do you guys have any thoughts on that question?
I think the akkermansia, so far the data is really powerful, but I use both. I like both.
Again, I have not so much used butyrate. I guess it's been a little less clear to me whether or not, depending on what you're trying to accomplish, whether or not the butyrate actually survives sort of the trip through the GI tract and makes it to the colon, which is obviously where the akkermansia is and where a lot of this stimulation of GLP-1 is happening. But again, I think a lot of this has to be based on clinical experience, which obviously Dr. Jill has, and informed by the evidence that's out there.
Yeah. One more question kind of on the flip side of things. What do you do if you are stool testing and a patient comes back with high akkermansia? What are your examples or instances in this case?
Well, I would say, number one, it's very, very common for patients to have overgrowth of bacteria. And this would be things that are really good, like Lactobacillus, Bifidobacter, and Akkermansia. So my first thought when I see that is I need to test for SIBO and rule out bacterial overgrowth. And I don't know, I can't say for sure. This Akkermansia is not a typical SIBO organism. Typically Streptococcus, Staphylococcus, some bacilluses are the common organisms and even fungal organisms. But when I see high levels, I would just look at that and rule that out.
Yeah, and I would just add, really thinking from the perspective of what does the science tell us, I think the jury is still out. However, most of the evidence points to higher levels of akkermansia being, as we have in the slide here, more related to this sort of compensatory response. In other words, it's the body's way of responding to a challenge by saying, let's increase the levels of akkermansia and have this akkermansia help us address whatever the, medical issue is that the body is sensing there's a problem, or the bacteria in the body is sensing is problematic. And so, again, there may be this beneficial response. That being said, what I have typically recommended in my practice is increasing polyphenols either through diet or through supplementation. There is some evidence that they are neuroprotective. And again, all of that needs to be really considered within the context of what is the overall clinical picture. What is the patient complaining of? What are the medical issues the patient is dealing with?
Absolutely. Awesome. So finally, we come towards the end. I know we have a lot of questions coming through, but I want to get through these last slides, and then we'll get to all the questions left with our time remaining. But Dr. Jill, how has supplementation with live akkermansia impacted the health of your patients in practice?
Yeah, so I don't know if, I was say the cases are next. Let's go right to the cases.
Yeah. I jumped right to it. Sorry.
Perfect. Yeah. So I brought two just snapshots. These are as simple as I could make it with one slide, just so that you could see a snapshot of someone that is a real patient that had a good response to akkermansia. So I just put the very minimal details here to get you the snapshot. So this is a 55-year-old male accountant who was diagnosed with Hashimoto's 20 years prior to me seeing him, and metabolic syndrome. He had an A1C of 5.9, and his labs, A1C 5.9, fasting glucose was between 110 and 115. He was on levothyroxine for his thyroid, and we started a pendulum glucose trial. And as we mentioned, I usually ask patients to commit to 90 days because I think that's the minimum effective window where we would start to see a significant change. So he did. Within 1 week, he texted me and he said, "Hey, Dr. Jill, my fasting morning glucose is now 80 to 85. So that first week, that to me, that's why I put this slide here. It's like, this is a really cool thing. And then of course, over time, his A1C dropped to 5.5 over 90 days. So that was a pretty significant drop, kind of consistent with the research that you guys have internally. Within 30 days, he had lost 8 pounds. So he was really, really happy. And subjectively, his carb cravings were down by 50%. So I thought this was a great little snapshot of a pretty classical result that I see. And you do the next case if you want. We'll talk about number 2.
I'm sorry not to interrupt, but I just to add, just to make sure it's clear for people, because, obviously, you and I, Dr. Jill, are akkermansia fans, and we kind of went off on that. But, technically, the pendulum glucose control has akkermansia in it and 4 other strains of bacteria that I alluded to earlier, those butyrate producers and the Bifidobacterium infantis. And so, and to your point, most people in the research we've done saw a result within 90 days. Some saw results, of course, sooner, and that probably depends on a number of factors: degree of metabolic dysfunction, makeup of the microbiome, other factors such as that. But, typically we recommend, as you've said, Dr. Jill, at least a 90-day trial for most people, although you may see results sooner, certainly.
And I will say clinically, the glucose control, I think the synergy there is way more powerful than akkermansia alone. So again, my mind as a teacher has been like, akkermansia, we need this. And that's true. But if you're out there and you're just thinking akkermansia is the one size fits all, I think this glucose control and then the lesser potent metabolic daily, just for a cost perspective, both of those I think are more powerful than akkermansia alone. But of course, use your clinical judgment if you're a physician, or if you're a patient, ask your doctor which one might be the best for you.
Great point.
All right, next case. Okay, so this one is a 63-year-old female teacher. She is just hitting that BMI of obesity with a height of 5'3" and a weight of 170. And it's interesting because she requested, semaglutide. She did not tolerate it. She had awful nausea and abdominal pain and was off within a couple weeks. So that was kind of the background of this. She wanted to lose weight. She was a candidate because she was considered obese. She has a history of osteoporosis and IBS symptoms. And because of that lack of efficacy of the drug for her, I said, well, let's try this metabolic daily. Now for her, and you can speak to this, but talking to Colleen a few weeks ago, the glucose control is phenomenal. It is your kind of flagship, product, but it's really expensive, and rightfully so, because the research and the amount of effort it takes to actually grow these things, it's that way. But there's this alternative metabolic daily, which is the same exact strains, just a little bit more affordable. And for someone who's not full-blown diabetic, that's one of the ways that I differentiate with it's either a cost concern or a diabetic concern for her, because she was only metabolic syndrome, wanted to lose weight. I said, let's try this metabolic daily and see if we can't get a good response with the less potent version of the glucose control. So she started that. She was also on calcium, magnesium with D, and berberine twice a day, which can also be good for metabolic. I think of that, it's not exactly like metformin, but it has a similar mechanism of action. It can also decrease the bacterial overgrowth if there is SIBO or SIFO. So it's a good addition and combination. And after 12 weeks, she reported feeling more satiated after meals and had 80% resolution in IBS. That wasn't even what I was going for, but her IBS symptoms almost resolved, and her weight was down by 10 pounds, which for her, she was thrilled with and planned to continue this metabolic daily.
Yeah. I mean, it's a really interesting case. And the one thing that comes to mind, looking at her age and just thinking about my own clinical practice. And actually, when I first really got interested in the microbiome, I read a book. Actually, I was asked to write one of those comments on the book, like you get a preview and then and this was probably about maybe 11, 12 years ago. And I read in the book, or learned in the book, because I didn't know at the time, that women, when they get pregnant, there's a shift in the microbiome so that you absorb more calories from the foods that you eat so you can support the growing baby. And of course, we know that different stages of life are associated with shifts in the microbiome, including menopause. And I've had a number of patients who are postmenopausal and struggling to, let's say, live at the healthy weight they would like to live at. In that scenario, I typically write to the metabolic daily as sort of, all right, let's try this. You're on the right diet, you're exercising, you're getting sleep, you're managing stress, you're not quite getting all the results you'd like, or you've hit a plateau. Maybe there's an issue with the microbiome here. Let's see if metabolic daily can help you to get to that healthier weight that you've been, trying to maintain or trying to get to.
Yeah, and one thing that I realized, same thing, that the research on menopause and lower estradiol levels actually decreases short-chain fatty acids. So there's our link. There's one of our links to why women over the age of menopause, 45, 50, 55, 60, will start to actually produce less short-chain fatty acids if they have lower estradiol, which many of them do. And so this is another great reason, that because we know that one of the goals of both glucose control and metabolic daily is to actually increase those short-chain fatty acids.
Another podcast, the microbiome endocrine axis is another one.
Yes.
So in talking about kind of glucose control, metabolic daily, we have a question talking about if metabolic daily is more affordable, do its effects take longer than glucose control from your clinical experience?
Well, again, I kind of categorize, there's two questions. Of course, I'd rather have them have something than nothing. And the reality is some people can't afford certain things, or they have a budget on supplements, and that's real. And I'm totally okay with that. So glucose control is amazing. I'm on that one. And I don't even have diabetes. I just have a strong family history. And for me, it's worth the money, but not everybody can afford that. And so my choice is, number one, how severe is the metabolic dysfunction? If it's full-blown diabetes, I'm probably going to try to convince them to do the glucose control, because we have more data on your population. When you did this study, was all diabetics. And I think if I'm quoting her right, it was the 90 days and the A1C actually dropped by 0.6% or 0.6, right?
Correct. That is correct.
Phenomenal. And I actually quote that to the patients. However, whether it's a cost issue or you just have an A1C of 5.6 and you want it lower, or you want to lose a little weight, I love the metabolic daily for the average person. And we just quoted in the beginning, 1 in 10 Americans is diabetic, but 1 in 3 male and female have metabolic syndrome. So I would say I'm reaching for those pre-diabetes weight loss kinds of patients that maybe have a cost issue. We'll go with the metabolic daily every time, just because it's an easy, accessible, affordable. I don't know yet, and I don't know that you guys know exactly how they compare to one another, but to me, it's still a great option.
Yeah.
Another great question, another study we're talking about doing, as a matter of fact. But I think the approach that you've taken is very similar to the approach I take in my practice as well. And I think if they clearly have, you know, type 2 diabetes or more significant metabolic dysfunction, then I try to go with the PGC, the glucose control. But the metabolic daily is also an excellent option.
Yeah. So with that, can you take too much of these products? If someone was taking one metabolic daily and glucose control together, is there any research that you can kind of overdo it?
Well, they're the same strains with different amounts, correct, Dr. Perlman? I'll let you maybe speak to that.
No, that's correct. I mean, we certainly don't have any data. I'm not aware of any data that would suggest that, you know, would looked at this issue, you know, can you take too much? I mean, I would also answer by saying maybe remembering what you said just a few moments ago, that more isn't necessarily better. And I think I usually don't encourage or I discourage my patients from just piling on more and more, thinking they may get better results. And of course, the more of something you take, the more you risk a potential side effect. So, you know, normally if someone wanted to add to the, let's say, potential efficacy, we recommend taking the polyphenol product, for example, or really focusing down even more on the kind of changes you may be making in diet and lifestyle.
Yeah, and I'll just also speak to, there's a real common mast cell activation disorder out there where people are super sensitive to everything.
Mhm.
And if probiotics are an organism and it's new to your body, and so if you're concerned about that kind of an issue with you or you've reacted to probiotics in the past, you could open these up and take a partial dose. I've had patients do a quarter of a cap or half of a cap as they tolerate it, because what can happen when you add probiotics in, especially the good kinds of probiotics, they can actually cause some die-off of the bad guys. It's almost like there's a fight in there in the small and large bowel. And so if you're concerned, I haven't had this happen commonly, but if you're concerned or I have a patient who's incredibly sensitive, it would be perfectly appropriate. I've clinically told them to open it up, start with a half cap, and then work your way up.
Awesome.
There, I might just add, what I've seen in my practice is when there are real extremes of dysbiosis or imbalance of that gut bacteria, more to the level of you suspect there may be small intestine bacterial overgrowth. I mean, if I hear from a patient they've taken any probiotic and it seems to make their symptoms worse, particularly those symptoms are GI upset, bloating, these sorts of things, I immediately think SIBO or small intestine bacterial overgrowth. And I have found, I don't know what your experience has been, Dr. Jill, but that you need to really kind of knock down some of that excessive growth first before you can sort of then re-inoculate or kind of bring back the balance that the individual is trying to find. And I mean, there's certainly natural protocols. There are, of course, medications, antibiotics that we use. But one way or another, kind of if it's in an extreme, just piling more things into the system doesn't necessarily make it better.
I would totally agree. Order of operations is kind of clear that bowel in a healthy way first and then repopulate or re-inoculate the proper probiotics.
I know we have just a couple more minutes here, so I think we can get to a few more questions, just because you guys have such good clinical experience, can't get enough. But before I ask those last two questions, I want to leave this slide up just to let everyone who's on our website, patient protocols, if you're thinking about low and high akkermansia. So definitely check those out. And if you have additional questions, also you can shoot us an email, and we'll put the email in the chat. But just to keep your guys, the clinical experience in your a couple more questions I want to call out related to more of a clinical question. Someone wrote, I have a patient who is at least 7 years post-gastric bypass with good weight loss, who they suspect has a leaky gut, but also reactive hypoglycemia. They're wondering if you have any recommendations for this patient.
One comment I would say with gastric bypass or any sort of colon resection like post-Crohn's or colitis, you're almost always going to alter the small intestinal milieu, which means you're very, very high risk for a small intestinal bacterial overgrowth or fungal overgrowth in these cases of surgery. So you can almost assume, number one, leaky gut, and you can assume, number two, probably some sort of overgrowth. So I would start by, like we both, Dr. Perlman and I agreed, testing first, and then maybe treating the overgrowth before I give probiotics. And then after that, I would think about probiotics in that patient for sure. And I think depending on their metabolic situation, metabolic daily or glucose control would be great choices.
Couldn't have said that better myself.
Thanks, Dr. Jill. Okay, one more question, and then if you have any outstanding questions, we will answer them via email and make sure we get you some good answers. But someone asked about, I know, Jill, you mentioned pasteurized Akkermansia. So comparing, is live Akkermansia better than pasteurized Akkermansia is one of the questions that came in.
So that's a great question. I don't know that I have the answer, but I do know that so far with the research that's come out of Pendulum, that's one reason I respect you guys so much. I talked to Colleen and we did a webinar. If you, I'll make sure and link that up here too, because it's a great conversation with me and her. And what I realized is I loved her conversation on the research, right? She went out there, threw out these 5 strains and said, whatever happens, it could take down the company if it doesn't work. But what happened was it worked really, really well. And I love the honesty of your company for that, because you threw out what is the best science on what strains might help. Let's see what we can do. And let's actually pay for a study that could take us down if it doesn't show good results. And what happened was you showed phenomenal results. And I have the deepest respect for Pendulum for doing that. And for even the investors and everyone, like putting yourselves on the line for science. And then actually the serendipity of it is it really works, and it works well. So I think I love ending with that, because it's just such a powerful testimony to the fact that you guys are really dedicated to the science of this.
I know, I mean, I could dedicate a whole podcast to that subject. I've been diving deep into it, and you know, I think the way you've answered it is really accurate. I guess I would say, maybe as a snippet, because we don't have time, is, you know, bacteria die, but they don't come back to life. And, you know, what I would say in my read of the literature is that if you take live bacteria, you get all the benefits of live bacteria. There are some benefits to dead because they also signal, and you would expect in a ecosystem that an increase in dead bacteria would signal something to that system. But when you take live, you get all the benefits of dead. When you take dead, like I said, they're never coming back to life. Yes, it's less expensive to manufacture pasteurized dead probiotic, but as you've already said, Dr. Jill, I mean, because of the added benefits to live, you know, the company was committed to finding a way to grow live and anaerobic bacteria and make it available to the public, and that's really what they've done.
I love to end it on that. That was such a great answer and such a great commentary between both of you. Thank you for your time and your clinical experience. And we're going to leave it on this as